Hi everyone, I'm Megan Vanoy and I am an online myofunctional therapist. I started releasing videos recently about myofunctional therapy and how it can help people breathe better all over the world. I wanted to start a series about myofunctional therapy basics over the course of the next couple weeks just to give you guys more information. Today I'm going to start with what I think is probably the most relevant part of basics, and that is what is myofunctional therapy. Myofunctional therapy is based on a series of exercises that help patients learn to change bad habits. That improves tongue placement, breathing, speaking, chewing, swallowing, which can all have a huge impact on their overall health and well being. As you start to look further into myofunctional therapy, you may find other names for it, like oral facial myology or tongue thrust therapy. They're all the same thing. If you can envision physical therapy and how they help rehabilitate and train muscles to function like they're supposed to, then you can apply that idea to myofunctional therapy. It's very similar to physical therapy, but for the face, the mouth, and the tongue muscles. I teach people exercises to help improve their function in their muscles, basically from the neck up. The exercises revolve around the tongue as a majority, and I evaluate patients for tongue ties and tongue thrusts, but I always tell my patients during those evaluations, those are just clues that there's a bigger underlying issue with your airway. And that's what we really, really focus on with that is your airway and your ability to be able to breathe like you're supposed to. Myofunctional therapy is all about changing habits and strengthening muscles to improve the way that we breathe, the way that we speak, chew, swallow. And it's possible, honestly, to have life changing results from a myofunctional therapy program, such as eliminating a mouth breathing habit or easing sleep apnea symptoms. But it's also worth bearing in mind that every patient is different. Some patients may experience jaw pain or suffer with mouth breathing, while others may have been told that they're tongue-tied or they have a tongue thrust. Myofunctional therapy is a type of treatment that looks at the way the tongue and the oral muscles move and function. Some of the issues may seem normal, but just because everybody else snores or everybody else breathes through their mouths, even headaches, migraines, suffer from asthma, allergies, ADHD, all of those things have become the norm. But just because so many people may chronically deal with the symptoms, it doesn't make it normal. Dysfunction's never normal. What if we could teach your body, your mouth, and your tongue to work for you versus working against you? With myofunctional therapy, that's what we do when we work together. You may be asking yourself even, why haven't I heard of myofunctional therapy? And there's no easy answer, but myofunctional therapy has become more and more recognized over the past few decades, and it's still not always widely known or understood. This is because most dentists, pediatricians, orthodontists, and ENTs were simply never trained in myofunctional therapy as part of their medical or dental education, so they may not fully understand it. Even myself, as a dental hygienist, only found myofunctional therapy through working with an airway dentist and then researching further once I wanted to expand my career and help people in different ways. This is definitely changing as the whole body approach to healthcare becomes more and more popular. I hope you've gotten a better understanding about myofunctional therapy and are excited to learn even more. As always, thank you for watching my video. Give me a like, a comment, and subscribe to stay up to date as I continue my series on the myofunctional therapy basics.